Vanakkam Makale. See, the resistance training exercises can be of two types. One is isometric and another is isotonic. Okay. See, when you move the joint, it is isotonic. When you keep it static, it is isometric. I'll give you an example. If I move this weight for my elbow, this is isotonic exercise for the elbow. If the same weight, I am holding it, but I am not moving the joint, I am not disturbing the joint, but I am just holding it, it is called as isometric. Now apply the same for the cervical spine. Without moving the joint, if you put pressure by the side, by the back, and then in front by this side, just press it and create a pressure. This is called as isometric exercise for your neck muscle. But I said in the last video that generally I don't advise these exercises for my patients here, because most of my patients who come here, they come with acute pain or a severe level of disc prolapse. At those times, this exercise is not advisable. Okay, so but how you will strength train your neck muscle is, it is just by your active range of movements of your neck within the pain free limit, because this active range of movement with your head as the weight, counter weight, that itself will give you a strength training for your neck muscle. If they improve and they come on the second stage or third stage where a little more heavier exercise can be given, then the isometrics in lying can be given. It will be given like this. See, lie down like this, lift your head up, not like this. This becomes the full range of movement exercise. But isometric is this, just lift it up, hold it for 2 breath counts, then down, lift it up, down. Just attempt to lift, try to lift. You don't need to even lift it. Just trying itself engages the muscles which are responsible for that movement. Engage the muscles. Down. Okay, and then as I said, towards the side, turn towards the side, bend the lower limb, keep this leg straight, support your head to be in neutral and make it straight with your spine. Just lift it, attempt to lift, then down, attempt to lift, then down. And the same on the opposite side. You turn towards this side, keep the lower limb bent, upper leg straight, line with the body, lift up, then down. Just attempt to lift, then down. And then comes the prone. You go to the prone position. Okay, so lie down like this, lift the head and down, lift it down, lift it down. If you lift it fully, it becomes isotonic exercise for the neck. Isometric, you just lift it and then keep it down. Mostly this prone position, this exercise feels too easy because the extensors of the neck, the back muscles of the neck are too strong. So particularly in that range, the exercise feels much easier. Okay, so with that, the isometrics of the neck exercise ends. Okay, it is too simple. And then comes when to use braces or cervical collars for your neck. Okay, see, cervical collars, when the pain is too acute or the disc bulge or the prolapse is too severe and the radiating symptoms are too severe, patient or that subject is unable to hold the neck actively, then the cervical collar becomes necessary. Okay, and when you give a cervical collar, it should not be used more than 30 to 40 days. You should have a time limit for using any support in the body. It is not only collar, any support. It can be knee support also. There should be a time limit. You cannot use it for like lifelong. It is not. You should not. Okay. Why? Because you are wasting the muscles which are supposed to do that function. The major causes of spinal problem, we can broadly classify them into 3 types. Like first is your postural problem, maintaining a poor posture. The second one is repetitive stress injury. Example is sitting in a computer doing the same job for long hours continuously for years. That may cause repetitive stress injury. And the third is, we can put them in lifestyle, like having poor hydration, drinking less water than the required, and having inadequate nutrition, poor nutrition. And the last one is the trauma. RSA can also come in trauma, but the real trauma is like accidents or a fall. All those things causes all this spinal problems. And when you think about spinal problems, whenever you have a repeated pain or a long term pain, better to go and consult a health profession rather than doing your own exercises or treatment, home remedies like that. Better to consult a health professional, get it corrected as early as possible, so that you can save your spine and the related structures. Thank you, Makale.